I welcome all the dear doctors to Kidscovery, a pediatric class initiative by me. I am your faculty, Dr. Parv, and we are discussing about pediatric orthopedics. So the topic which I have taken to be discussed in this video is osteopetrosis. Osteopetrosis. Okay. So what is osteopetrosis? Osteopetrosis is a hereditary bone disorder which happens because of osteoclast dysfunction, and that is why there is defective bone resorption and there will be dense but brittle bones. There will be dense but brittle bones. See, if I just tell you in a much more detail, osteopetrosis is a condition where you will have at some point of time the osteoblasts are going to be very active. At some point of time the osteoclasts are very active, okay, and of course the counterpart, like if the osteoblasts are very active, the osteoclasts are not working fine, and if the osteoclasts are functioning properly, osteoblasts are also not functioning well. So this is just a disease where you will have what you will have. Somewhere you will have the dense bones, and then somewhere you will have the lighter bones. Okay, so this is a thing which is actually seen. Okay, dense bone, light bone, dense bone, light bone, like that. So see, students, this dense formation and defective resorption leads to the bone formation like this. Okay, and what I have to tell you is, see, pediatric osteopetrosis is not very much adult one. Okay, so there are so many signs which you see in adult osteopetrosis. Pediatrics doesn't have much of the signs. Okay, but of course what is important I am going to teach you. So remember, there is an autosomal recessive disease which is called as osteopetrosis congenita, and there is an autosomal recessive disease which is called as marble bone disease. This is because of a carbonic anhydrase deficiency. So RTA, that means renal tubular acidosis. We have taken a lecture on renal tubular acidosis, so you can just watch that lecture, because in RTA type 3, renal tubular acidosis type 3, we have discussed this already, that there is a calcification which is going to happen. That's why it's a bone disease, and the bone disease which is associated with RTA type 3 is none other than pediatric osteopetrosis. So as I've told you that the strength is not there in the bones, so bones are brittle bones which have the frequent fractures. There is a cranial nerve compression also. See, for example, if there is a lot of bone which is dense bone which is there, so the cranial nerves are going to get compressed. Okay, so there is a cranial nerve compression which is going to happen, and since the most of the area is getting covered by the bone itself, that the central part, this part where the bone marrow was supposed to be, is not going to function properly because of the less space, and since the bone marrow is not functioning properly, there will be anemia, pancytopenia, and yes, there can be hepatosplenomegaly. Why? Because the bone marrow is not functioning. This function is taken care by the spleen, taken care by the liver. Okay, so liver and spleen will have the erythropoiesis. Now what happens? See, the bone is not getting formed properly, so there will be short stature, there will be retardation, and in very severe forms, when the calcification is occurring so much that increase in calcium, the blockage in the ducts is going to happen, and that can cause hydrocephalus. So these are some things which you have to remember. Even if you forget everything, please remember A, B, C. Cranial nerve compression, B for brittle bones, A for anemia. So what are the complications? I have told you all these things we have discussed, so we are not going to discuss again. Just remember that X-ray is going to show you a marble bone appearance. Okay, this also we have discussed, and renal tubular acidosis. So blood test is going to show cytopenias. All the counts will be less, and of course fractures etc. can occur. Okay, see, can you see this? So here there is a lot of there's a lot of ossification which has occurred. Here there is no ossification which has occurred. See, here there's a lot of ossification has occurred. Okay, so there are actually the areas where calcification, where ossification is very much, but then osteoclasts are not functioning properly, so the bones are actually brittle bones. Bones are actually brittle bones. Okay, so what to give as a treatment? So we have to give transplantation, which is actually the curative treatment. Bone marrow transplantation has to be given. Then in order to slow down the disease progression, we give gamma 1b, interferon gamma 1b. So how to remember? Interferon gamma I for inhibits the disease progression. Inhibits what? Inhibits the disease progression. After that, prednisone is given. Yes, prednisone is going to prevent the remission. Okay, prevent the remission. And since marble bone disease is renal tubular acidosis, we give the alkaline therapy in these cases. And if the deformities are very much, then orthopedics and surgical corrections can be done. Okay, so this is a small topic that is called as pediatric osteopetrosis. So thank you so much for watching. And yes, since we end our lectures on questions, I want you to write what are the named signs in osteopetrosis. What are the named signs in osteopetrosis? Thank you so much. We'll meet you in the next class.